Have you ever felt like your body suddenly became a stranger to you? Like one day you woke up and nothing worked the way it used to, your sleep was gone, your moods were unpredictable, your brain felt foggy, and no matter what you did, the weight just kept creeping up. And the most terrifying part? Your doctor looked you in the eye and told you everything was fine. If that sounds familiar, I need you to stay with me right now, because what I'm about to share with you could genuinely change the trajectory of the next decade of your life. My name is Dr. Mary Williams, and I have spent over 20 years working with women in their late 30s, 40s, and 50s, women who came to me frustrated, dismissed, exhausted, and convinced that they were either losing their minds or simply getting old too fast. And in almost every single case, the answer was the same. They were in perimenopause. And nobody had told them. That is not an accident. That is a systemic failure. And today, we are going to fix it, at least for you. Let me start with the most important thing I can possibly say. Perimenopause is not menopause. Most women think they'll know when the change is coming because they'll stop having periods. That's menopause. Menopause is actually a single moment in time, the point at which you have gone 12 consecutive months without a menstrual period. Everything before that moment, which can span anywhere from 2 to 14 years, is perimenopause. And perimenopause does not announce itself with a welcome sign. It sneaks in through the back door, disguised as depression, anxiety, insomnia, weight gain, brain fog, joint pain, heart palpitations, and 100 other things that sound absolutely nothing like what most women have been taught to expect. A landmark study published in the journal Obstetrics and Gynecology found that the average woman spends 4 to 8 years in perimenopause before reaching menopause. 4 to 8 years. That is nearly a decade of your life spent in a hormonal transition that most women are never properly educated about. And the research shows that the majority of women don't recognize they're in perimenopause until they're already deep into it, sometimes years in. Why? Because the symptoms start so subtly, so gradually, that women do what women have always been trained to do. They push through. They adapt. They assume it's stress, or burnout, or just a bad phase. Here is what typically happens. A woman is 38, maybe 42. Her life is full. She's working, maybe raising kids, managing a household, juggling relationships. She starts sleeping poorly. Not terribly, just not great. She starts feeling a little more anxious than usual. Her patience gets shorter. She cries at commercials she would have laughed at before. Her periods are still coming, maybe even totally regular, so she thinks, this can't be hormones. I'm too young. I'm still getting my period. And so she dismisses it. Her doctor, if she even mentions it, often dismisses it too, because her blood work comes back normal and her periods are still happening. And here is where the science becomes absolutely critical to understand, because this is the exact point where most women, and tragically, most doctors, get it completely wrong. Perimenopause begins not when estrogen drops, but when it starts fluctuating. This distinction is everything. In the early phase of perimenopause, estrogen can actually spike higher than it ever did during your normal reproductive years. It swings wildly up and down, week to week, sometimes day to day. Research from the study of women's health across the nation, which followed over 3,000 women for more than 2 decades, confirmed that these erratic hormonal fluctuations begin years before periods become irregular. And standard blood tests like FSH and estradiol, taken on a single day, are completely unable to capture this volatility. A woman can go into her doctor's office on a day when her estrogen happens to be normal or even elevated, get told her labs are fine, and walk out thinking she's imagining everything, when in reality her hormones have been on a roller coaster for the past 2 years. This is why so many women are misdiagnosed. The anxiety gets treated with antidepressants. The insomnia gets treated with sleep medication. The brain fog gets chalked up to stress or aging. The weight gain gets met with a lecture about diet and exercise. And the woman sits there nodding, going home and trying harder, eating less, sleeping more, meditating, exercising, and still feeling like something is fundamentally, inexplicably wrong with her. Because it is. And it has a name. And it has solutions. But she never gets there because nobody connected the dots. Let me walk you through the most commonly missed symptoms of perimenopause, because I want you to hear this list and think back on your own experience. The first one is sleep disruption. Not hot flashes waking you up, that comes later for many women. I'm talking about waking up at 3 in the morning for no reason, lying there completely awake with your mind spinning, unable to get back to sleep. Or taking forever to fall asleep even when you're exhausted. Research published in the journal Sleep Medicine found that women in perimenopause experience significantly more sleep disturbances than women in their premenopausal years, even before hot flashes begin. Progesterone, which begins to decline earlier than estrogen in many women, has a direct sedative effect on the brain. When progesterone drops, sleep quality drops with it. The second is mood changes. And I don't mean just feeling a little sad sometimes. I mean rage that comes from nowhere. Anxiety that feels like something terrible is about to happen even when everything is objectively fine, crying without knowing why. Feeling emotionally dysregulated in ways that feel alien to your personality. A study from the Harvard Study of Moods and Cycles found that women with a history of depressive symptoms were significantly more vulnerable to mood episodes during perimenopause, but critically, even women with no prior history of mood disorders experienced new-onset anxiety and depression during this transition. Estrogen modulates serotonin and dopamine. When it swings unpredictably, so do your neurotransmitters. This is not a character flaw. This is neurochemistry. The third is cognitive changes. Brain fog, word retrieval problems, difficulty concentrating, forgetting things you would never have forgotten before. Women describe this as terrifying. They come into my office thinking they have early Alzheimer's. Research from the Menopause Journal showed that verbal memory and processing speed measurably decline during the perimenopausal transition and then stabilize after menopause. The brain is actually adapting to a new hormonal environment. Estrogen supports neuroplasticity, synaptic function, and glucose metabolism in the brain. When it becomes erratic, brain performance follows. The fourth is changes in body composition. Weight gain, particularly around the abdomen, that seems to happen regardless of diet or exercise. This one is deeply demoralizing for women because they feel like they're failing when they're not. Research shows that the hormonal changes of perimenopause directly affect how and where the body stores fat. Declining estrogen causes a shift from subcutaneous fat storage, the kind distributed around the hips and thighs, to visceral fat storage around the organs. Insulin sensitivity also changes, making blood sugar regulation less efficient. You can eat exactly the same way you ate at 35 and your body will respond completely differently at 45. That is biology, not laziness. The fifth is heart palpitations. This one frightens women enormously, and it should be evaluated medically, but it is also extremely common in perimenopause and vastly underrecognized as a hormonal symptom. Estrogen plays a direct role in cardiovascular function, affecting the electrical activity of the heart. Fluctuating estrogen levels can cause palpitations, racing heart, and even chest tightness that sends women to the emergency room with completely normal EKG results. A study published in Menopause found that nearly 40% of perimenopausal women report palpitations. 40%. Yet it is rarely listed in standard patient education materials about perimenopause. The sixth is joint pain. Aching hips, knees, fingers, wrists, pain that migrates and doesn't follow the pattern of typical injury or arthritis. Estrogen has powerful anti-inflammatory effects throughout the body, including in the joints. When estrogen fluctuates, inflammation increases. Women describe feeling like they aged 10 years overnight. This is one of the symptoms most likely to be sent to an orthopedist or rheumatologist with no hormonal workup at all. Now here is where I need to talk about something that I believe is truly at the heart of why women miss perimenopause for so long. And it's not just about symptoms being subtle or variable. It's about the story women have been told their whole lives about their bodies. Women are taught that hormonal symptoms are something to endure, not address. They're taught that feeling bad around their cycle is normal, so they learn to dismiss body signals. They're taught that the change happens in their 50s, so they don't consider it in their late 30s or early 40s. They're taught that if their periods are still coming, everything must be fine hormonally. Every single one of these beliefs is either wrong or dangerously incomplete. And these beliefs, reinforced by decades of inadequate medical education around women's hormonal health, create a perfect storm of delayed recognition and delayed care. There is also the issue of the medical system itself. A 2019 survey of medical residency programs found that fewer than 20% of OB/GYN residency programs in the United States provided any formal training specifically on menopause and perimenopause management. That means the majority of doctors practicing today received virtually no structured education on one of the most universal health transitions that affects half the population. This isn't a blame game. It's a reality check. And it means that women cannot rely solely on the medical system to recognize and name what they are experiencing. They need to come in informed. They need to come in with language. They need to be able to say, I think this might be perimenopause, and ask the right questions. So what are the right questions? What should you actually be asking? If you are a woman between the ages of 35 and 55 and you are experiencing any combination of the symptoms I've described, especially if they seem to have emerged or worsened in the past 1 to 3 years, you should be asking your doctor specifically about perimenopause. You should ask whether your symptoms could have a hormonal basis. You should ask about progesterone testing specifically, not just estradiol, and ideally hormonal testing done across multiple points in your cycle rather than a single snapshot. You should ask about the clinical assessment of your symptoms, not just your lab values. Because here's the truth, perimenopause is a clinical diagnosis. It is based on your experience of symptoms and your life stage. It is not solely dependent on lab numbers, and a doctor who tells you your labs are normal therefore you can't be perimenopausal has missed the point of how perimenopausal hormonal changes actually work. You should also be asking about treatment options. And this is where I need to address the enormous amount of fear and confusion that surrounds hormonal therapy, because this fear has caused immeasurable suffering. In 2002, the Women's Health Initiative published findings that were widely reported in the media as proof that hormone replacement therapy caused breast cancer and heart disease. Women stopped hormone therapy by the millions. Doctors stopped prescribing it. And an entire generation of women suffered through the perimenopausal and menopausal transition without any support because of a study that was deeply misrepresented in its public communication. The study involved synthetic hormones, primarily conjugated equine estrogen and medroxyprogesterone acetate, given to women who were on average 63 years old and already years past menopause. When you look at the data for women who started hormonal therapy within 10 years of menopause, and particularly younger women in their late 40s and early 50s, the risks look completely different. The Menopause Society, formerly the North American Menopause Society, has since published clear position statements indicating that for healthy women under 60 and within 10 years of menopause onset, the benefits of hormonal therapy generally outweigh the risks. But the fear from 2002 has never fully left public consciousness. This matters for perimenopausal women specifically because perimenopause is often when intervention can have the most meaningful impact on symptoms, on brain health, on bone density, on cardiovascular protection, on quality of life. And women who are in their early 40s, struggling with mood instability, insomnia, and cognitive fog, are often not even offered the conversation about hormonal support because they're assumed to be too young or because their doctor doesn't recognize the hormonal basis of what they're experiencing. I want to be clear, hormonal therapy is not right for everyone, and it is not the only option. There are non-hormonal interventions that have meaningful evidence behind them. Regular vigorous exercise, particularly resistance training, has been shown to significantly reduce the frequency and severity of hot flashes, improve mood, protect bone density, and reduce abdominal fat accumulation during perimenopause. A study published in Menopause International found that women who engaged in regular resistance training during perimenopause had measurably better outcomes across multiple symptom domains compared to sedentary women. Dietary changes, particularly reducing refined carbohydrates, increasing protein, and supporting the gut microbiome, can meaningfully influence how the body metabolizes estrogen and manages inflammation. Cognitive behavioral therapy has been shown in multiple randomized trials to be effective for perimenopausal insomnia and mood symptoms. Certain supplements, including magnesium, ashwagandha, and certain formulations of phytoestrogens, have emerging evidence for symptom support, though the research is still evolving and quality control in the supplement industry is inconsistent. The point is not that there is one answer. The point is that there are answers, real, evidence-based, meaningful answers, and women deserve access to them. What I want you to take away from everything I've shared today is this. If your body is speaking to you, and something feels like it changed in the last few years, trust that signal. Your lived experience is data. The fact that your labs came back normal doesn't mean your hormones are fine. The fact that you're still getting your period doesn't mean you're not in perimenopause. The fact that you're in your early 40s doesn't mean you're too young. You are not too sensitive. You are not imagining it. You are not falling apart. You are navigating one of the most hormonally complex transitions the human body goes through, a transition that has been profoundly under-researched, under-taught, and under-discussed for generations. The average age of perimenopause onset is 47, but it can begin as early as 35. The window in which we can intervene most effectively to protect brain health, bone density, cardiovascular function, and mental health is earlier than most women think. Every year that passes without recognition is a year without the right support. I've seen this story end two ways. I've seen women who came in informed, who advocated for themselves, who found a provider who took them seriously, who got the right support, and who moved through perimenopause with their health, their relationships, their careers, and their sense of self intact. And I've seen women who didn't get there in time, who spent years on the wrong medications, who developed anxiety disorders that could have been prevented, whose marriages struggled under the weight of unexplained emotional volatility, who gained weight they're still fighting, who look back and grieve the years they lost to not knowing. You now know. That changes everything. If you recognize yourself in what I've described today, start the conversation. With your doctor, with a menopause specialist, with a functional medicine provider, with a community of women who get it.do, not wait for it to get worse. Do not wait until you're absolutely certain. The cost of acting early is minimal. The cost of acting late is years. Your body is not betraying you. It's in transition. And with the right knowledge and the right support, this transition does not have to be something that happens to you. It can be something you move through with clarity, with agency, and with your full, brilliant self intact.